Slide.
No problems on the left side, right?
Stop to let's.
Are you ready already?
Yep.
It's on live?
It's live.
Really?
Yes.
Okay. Right, so friends, we're doing a facial asymmetry correction with genioplasty. So it's been quite some time that we've gone online. So today, this Saturday, we're going to show you, or basically we're going to see some surgery live from our OT. And the plan for this patient is we're going to correct the asymmetry by working on the patient's entire mandible. So you're going to see the patient's pre-op and our plan in a short while from now.
Alright, so as you all heard, this is a facial asymmetry correction procedure that is being performed by Dr. Richardson, and along with a genioplasty. Now let me show you the clinical pictures of this patient. So this is the frontal view. This patient came to us with complaining that both his left and right sides are not equal. So you see this side is longer than the other, and he complains of a receded chin. So we plan.
Case history can be mentioned here. Fact that he had torticollis.
Yes. So
several years that actually caused this facial asymmetry.
This patient had gives a history of torticollis, that is a wry neck. That means he had a drooping shoulder one side, and this patient now has come here specifically to do some bony osseous work, and that's what is being performed right now. We are in the OR. Now let me take you through the procedure. So what do you first mean by a genioplasty? It is correction of any chin abnormality, a surgical correction where we do augmentation both in the horizontal and vertical direction, although there are different other kinds of genioplasty also. We can even do an osseous genioplasty or reduce it in some cases. That's very rare. There's extended genioplasty, sliding, different forms. But for this patient, it's going to be a straightforward horizontal as well as a vertical augmentation, more in the horizontal dimension. Now, the other procedure, as we call it, an angle osteoplasty, meaning his complaint of the asymmetry over the jaw, which you can see in the frontal view here. See this side. So this angle is going to be corrected. We're going to do some work on the bone, and which will align with the chin. So he's going to get a nice jawline here. So next, moving on to there is fixation, plates, screws, the systems that you see here. Here what is open right here is what we call osteotome. So basically it starts with an osteotomy or a cut, which is made with the help of a surgical saw, which will be showing you shortly once we reach that stage. And once we have made the cut, we are going to do some osteotomy. Right there you can hear the sound. So that's the unit that can you show us that? That is and that is the sound which is rolling now. So we've made markings on the chin, and just right over the marking we are going to osteotomize the chin segment, which is happening right now as we speak. And once it is osteotomized, we are going to fix it with plates and screws in the desired position.
So this is the saw. I'm just using this saw right now. What I said. So you can see this is a saw that we use to cut a lot of this bone. And, it really cuts bone like butter. Trying to show you how quickly put your hand, that's it.
You see a lot of support is needed. This is a teamwork because there is soft tissue around the bone, around the chin area, and the oral cavity as such is itself small. So we have to do a lot of retraction so that while Dr. Richardson is using the saw, the patient is not, none of the soft tissue area is injured. So a lot of retraction is needed. Now I'll show you the basic surgical instruments which are being used. So you see here a lot of plate benders, some forceps to hold the plates on while we are fixing it. In case you have any doubts regarding the surgical procedure, you can comment, you can just post your comments. Alright, and this one is the basic instrumentation, armamentarium that we need for any surgery for that matter. A lot of retractors here, some forceps, elevators. And right here are the plates which we will be using. We have both 3-hole, 4-hole plates depending on the bony segment, and also screws. And if you notice here, there are numbers over the screw. So 6 mm, 8 mm, 10 mm. 8 is what we generally use. Now, the post-op recovery, in case of just a genioplasty, about 5 to 7 days is sufficient. Although the entire approach is intraoral, that means inside the mouth. It's going to be a scarless surgery because the entire procedure is going to be done inside the mouth. No sutures will be visible outside. And the sutures which will be placed are resorbable sutures. About the pain and edema, some amount of pain will be there, but that is controlled by the analgesics, the painkillers that are given post-operatively. Genioplasty patients are relatively very comfortable throughout the post-op period. If you ask of any complication, it is definitely again pain, swelling, some amount of collection that can happen. But that also can be easily drained off. Patient has to be under our care for 5 days, and you're good to go back home. So you can actually chat with us while we show you this live surgical procedure. Keep commenting as you are already doing right now. So this procedure is called a genioplasty and jaw sculpting, as well as an angle osteoplasty. The sound that you hear is of a surgical saw that is being used to do some osseous manipulation. This is to give the patient a nice jawline. So the lower third of the face plays a very important role in facial aesthetics, and patients look much younger, much graceful, especially if their lower jaw is sharp, well defined. As you see, we've finished the work on the angle region. Mind you, there are two mental foramens or the mental nerve which supplies the soft tissue over the chin and the lower lip. So we are being very careful about that, and the mental nerves remain intact during this augmentative procedure. Okay, so I see a lot of people who have just joined in. If you have any questions, please shoot it in the comment section. Right now we are doing osteotomy on the chin segment, the segment which we are going to advance, and this is being done with the help of a surgical saw, as I said earlier. Although we can do it with just an osteotome, but that is time taking. Saw is much faster. Initially you will face a little difficulty as a surgeon to use it, but once you're experienced enough, it just makes your life easier. That's the osteotome I showed you earlier.
So when we cut bone, the bone tends to ooze a bit, and I know you can't see that, I don't want to show you, but I'm using something that's white. We call this bone wax. Bone wax is essentially prepared from honeybees wax. We don't prepare it, but the company makes these bone wax, but very useful to, you see how it stops bleeding? It gives you a nice clean area, and also because it's less bleeding, then the healing is faster also. Sanjeevana?
Now we are going to use some cauterization as in controlling the bleeding, and once we ensure a clear field, so once we ensure a clear field, that's when we are going to start doing our fixation. Now, with the help of something called as an Alice forceps, we hold the chin segment because it's quite unstable. We have even published that as an article publication in some international journal, where we hold the osteotomized chin segment stabilize it and then fix the segment into the desired position. That's what is happening now. The instrument that you see there, which is keeping the segment intact, is called an Alice forceps. And now we are going to do plate bending followed by fixation. Just as much as the patient desires. Now, genioplasty is no doubt an aesthetic surgery, a cosmetic surgery, but we can only do as much as we think is right. Sometimes we cannot listen to what patient wants, and because we have to take care of the facial proportion, the golden ratio, and how much in the end ultimately what will look good on the patient. Even the muscles. So there you see, we just fixed the screw on one side. So here again, let me show you the clinical picture of this patient. You see the facial asymmetry on this side. That has been corrected with an angle osteoplasty. Also right now, we've already finished the angle osteoplasty part. And now what we are performing is a genioplasty. Screw fixation is what we just showed you. We want to show you all the frontal and the lateral views. So we are doing augmentation in the horizontal plane. We are bringing the chin forward and downwards and fixing it in a position that will correct the asymmetry as well as give him a much more aesthetic look. So as you see, one plate has been fixed. Moving on to the second plate, two plates they suffice. Both the mental nerves are intact, which means although since the mental nerves tend to stretch after the surgery, patients do experience some amount of numbness or what we call as paresthesia, but that is transient, it's temporary. It recovers within, say, maximum a month or maybe even a few days. Now once we have fixed it, even intraoperatively we are going to remove all the retractors, check both the frontal and the side views, how it is looking, and then only proceed with closure. You can ask your questions related to the surgery, chin surgery, hard life. No, that's our life actually. So now we are done with the fixation, and we are going to start with what we call as jaw sculpting, meaning once we have augmented, once we have brought the segment forward, we need to ensure that there are no sharp edges and it is completely symmetric on both the sides. So some amount of...
It's not exactly that. It's also to ensure the correct shape of the chin, and the jaw. Sculpting is like sculpting, you just sculpt it. So you could sculpt when you cut, you could sculpt before, depending on the need. Now in this patient, one side I'm sculpting more, other side I'm hardly sculpting. Because of the fact that patient has got asymmetry. So that's what sculpting means. It's like to shave, to carve, whatever. That's the meaning of the word. So you could do it in different stages based on what the patient's need is. And well, it's a part of various jaw surgeries. Alright, wash. So we're just going to check now, since we fixed the segment and since we moved the chin on the angle. I'll show you how it's going to look for this. See that? It's got a very, very pleasing look straight away. So you can see the marking here. This is the original shape and I've got it in this way now. We've got very little work on this side, but I still have done there. So to get the symmetry, you can see that it's pretty symmetric. You've got the chin in the midline. Okay, cheek retractor.
So now we are beginning with the closure. Thank you for joining us for this surgery, and
so while Dr. Priya is going to help me suture up a bit, I just want to sum up the procedure. So we did this thing to correct the facial asymmetry, to improve the facial balance, and also to correct the issues the patient had because of torticollis. Torticollis is a condition of the sternocleidomastoid wherein the neck gets right, face gets towards one side, so it causes imbalance in the growth of the mandible. And so we've now corrected that by working on the entire aspect of the lower jaw, from the ramus, which is a vertical part of the lower jaw, the entire horizontal part, the front part of the jaw, which we call as the chin, this part again the body, all the way up to the angle. This ramus we haven't touched for this patient. So that's in short. Now we're just going to suture up. All the surgery is done from inside the mouth, and we've removed some pieces of bone. We've augmented some parts, so combination of osteotomies, osteoplasty and osteectomies, all three components done in this surgery. I hope this was useful. If you have any questions, so if you have any doubts, then you can shoot in your questions and we'll be happy to answer them for you.